Hello, I'm Dr. Ramsey, Amin, BurbankDentalImplants.com. The topic today is something called socket shield. This is kind of a hot topic, or they call it partial extraction therapy. And basically what it means and how it relates to dental implants is that you're actually leaving a piece of your tooth in place. So you're taking out part of the tooth and putting an implant sometimes next to it or over it. So the goal of partial extractions, and there's one called root submergence, and one called socket shield, and one called pontic shield, and then something called proximal socket shield. So the point of all of it is that your actual natural tooth is the best way to maintain your jawbone, like the width. If your tooth is there, even if it's root canaled and decayed and level to the gum line and broken and decayed, it still actually holds the bone better than any type of bone graft that I can make or anybody can make. So what we see sometimes in the upper front, people have really thin gums across the front if I'm doing an implant in that area, that if we take out the tooth, years later you can get an indent later right next to the implant, even if it has a bone graft in it. So this technique leaves like a little sliver, purposely leave behind a little sliver of tooth. It has to be a healthy portion of the tooth. It can't be diseased or loose. And what it does is it shields the bone from shrinking. That's why they call it socket shield. It's the most popular of all of them. It's a difficult procedure to do. It takes definitely some experience in doing it. And sometimes we'll leave like a whole root in. That's called root submergence in order to keep, kind of keep the volume of the bone present in that area. So it's been around about 10 years. It's got good documentation. It hasn't been around 50 years at all. And always the question is, well, what happens if the bad piece decays or has to come out? Can it affect the implant? It's most important that that piece has to stay under the gum line. And if we're keeping the whole root, it has to have a root canal or really healthy nerve to be underneath. So very few patients qualify for it, but it's really good, especially upper front teeth, anywhere where the bone is thin, because the bone, it gets its blood supply from the ligament around the tooth. So if you keep some of the root, it's actually a very useful procedure. It's called socket shield partial extraction therapy. I do it in my office as well. And just something to know about if you hear that out there. Thanks so much for watching, and we'll see you soon. Your comments are welcome. Thanks. Bye.